Hey, what's going on, folks? It is Necron370 here, and I saw something on TikTok. Actually, one of my friends sent it to me today, and it was a interesting video I saw where Alexa was talking about how the government was apparently responsible for the start of COVID-19. You see that, Cindy, there?
I did. I did see that. You showed that to me, and so did my girl Queen. She showed it to me.
Here,
That's
let's
kind
get
of
the audio
disturbing,
up
ain't
here.
it? Released the coronavirus.
According to Event 201, the government planned this event, created the virus, and had a simulation of how the countries would react. This simulation occurred October 18th, 2019. The government released the virus among the population and has lost control of the outbreak.
So that's the audio from the clip that was on TikTok, and it's been since taken down. Now, my very first question to that was, well, what the heck is the Event 201? And does that document even exist? So, after a little digging, I came across, well, actually, it wasn't much digging, it was pretty much right there. But I came across the Event 201, which I'll display here on the screen. And so the key points here are as follows. The John Hopkins Center for Health and Security, in partnership with the World Economic Forum and the Bill and Melinda Gates Foundation, hosted Event 201, a high-level pandemic exercise on October 18th, 2019 in New York, New York. Now, this exercise was designed to illustrate areas of the public and private partnerships that will need to be necessary during the response to a severe pandemic in order to diminish a large-scale economic and socialitic consequences. So, pretty much, Event 201 simulated an outbreak of the novel zoonotic coronavirus transmitted from bats to pigs to people that eventually transmitted or would be efficiently transmittable from person to person over time, leading to a severe pandemic. Now, this was just a thought paper, essentially, or just a group of people coming together to discuss what would happen. But the thing I find most interesting is this all took place this was done October 18th, 2019, and however, on December 31st, 2019, the World Health Organization had its first reports of the unknown virus, now known as COVID-19. And it's very interesting to just, if you continue reading through this article, some of the things it actually discusses, especially what it recommends countries do, and some of the problems we are dealing with right now is because these things weren't in place. And it's almost as if they're trying to, show what would
One
happen.
word, man.
And what's that?
Population control.
Yeah, no, well, because the projections estimated around 65 million people would become infected, and as you said, 18% or so would die.
I think it was like 18.4, but that's only of age 80 and above, and people who have like lung issues already, like asthma and stuff, and heart conditions, also are at a high risk to die from this. And that was like a study out of China, like 82,000 people were studied for this, and that's what they came up with. I think it was 18.4, I believe, somewhere around there.
Yeah.
It's
Still something. But as you continue going through the article, one of the interesting things I found is vaccines. So
no, I said population control because it seems like every nation is doing something different to prevent it. When I think that a lot of them have good points to do certain things, and maybe you should do all of them. Maybe, it doesn't seem to me, because I know you live in Canada and I live in the U.S., and in the U.S., I'm sorry, there's a lot of pretty much you have the symptoms, go isolate yourself until you don't have the symptoms, or until you're dead, I guess, if that actually happens from it. But it's kind of crazy. Even I went to Walmart, like everything's still freaking gone. I mean, you guys do realize that there's a lot of people out there, and bulking stuff up ain't gonna really help you at all, especially with 5 years of stuff. Either you're gonna get it or not. It's gonna spread. As you've seen in the last week, I think it went up like 50%.
Incredible rate.
50%. Yeah, I mean, I live in Nebraska, and it was 120. A number of cases, 125. It's still pretty low in Nebraska. And then in less than a week, it's at 270, and like 5 more deaths on it too. I mean, yeah, the death rate is not as high, but dang.
Yeah, on top of everything, don't expect to see a vaccine anytime this year. The earliest predictions of the vaccine, even in this Event 201 report, is the following year. Exactly. So no matter
they
what,
just started on it. They fucked up. I think what they did is they fucked up when they were researching this. I mean, this is
and they have a bunch of phases to this, and like this seems like a solid thought process. Like they even had companies, like a German company, CureVac, since 2015, they've been receiving money for work on mRNA technology, which specifically they've been now using it to develop a vaccine for the COVID-19. Odd how they were getting the funding for something that's specifically used to find the vaccine for this specific strain.
I think it was supposed to be for COVID-2
and that's the other aspect of this, for a thought process, for it to be the exact thing that we're dealing with. Like the outbreak was caused by bats not going to pigs, but it was directly from bats to people. And it's the novel zoonotic coronavirus, and it made the species jump.
Oh yeah,
and exactly like they thought in this. And I just find it odd how 2 months after Event 201 is released, we see our first cases in China, and then the massive death spike.
Yeah.
Now I will have all the references to all this information I put out. I'm not just getting it and throwing it out there all willy-nilly and just being like, "Oh, this is the right information." Blah, blah, blah. No, there's a bunch of information to it here.
I don't want you to be too scared of the death thing on there, but it is a possibility. I mean,
that's why governments around the world are taking their steps to try to critique it, or at least were.
I don't know.
We're seeing.
I mean, your country is I mean, you have an idiot president for ours. And I don't care if anybody hears me say that.
Shutting it down because we're not doing enough of a dent to the curve.
Man.
Like shutting down our major cities.
Well, yeah, that would help. I mean, New York in the U.S. is just. I feel bad for him. I read an article just this morning about a lady and her family who had got it and is sitting in her apartment now. She has, I believe, I read it on The Cut, okay, and that was on, which is a New York paper, I think, a digital paper or something, and the lady caught it. They're not sure who caught it first, but apparently they can work from home, so they're somewhat all right. But they have a 4-month-old baby and a was it a 4-year-old or a 2-year? I think it was a 4-year-old toddler who touches everything when they were at the park and everything like that. So it could easily be caught by, especially in that. And she can't go to any hospitals because no hospital will take you. They can't take the kid into a hospital neither. Apparently, what happens is you'll have like feverish, the flu-like symptoms for like a few days, like heavy fever, vomiting, diarrhea. Well, I'm not sure about the diarrhea thing too much, but the kids did apparently. They didn't say anything for them, and then it'll go away for like a day or two, and then it'll come back even worse the next time in the next couple days, and that's what happens. So
yeah,
it just
they're not
gets
even
worse.
sure about reinfection or mutation.
Yeah,
That's
it
the
could
other
still
problem with
mutate.
that.
It's still
it can.
a new one. So, and people aren't being as cautious as
And,
they should be. People are not being as cautious as they should be.
No, and that's the thing. Like, people have to realize that we are at now over 1 million confirmed cases and 53,000 deaths.
Well, here, I could give you stats
And
for U.S. right now.
Yeah.
They updated pretty quickly. Let's see what
they always do.
Yeah. Let's see what we got here. You can keep talking. I'll tell you when I find it there.
There are the state stats here. I got
Here we go.
confirmed cases, 270,000.
270? When was that updated?
This was updated 20 minutes ago.
Okay, the one I see shows an hour and 20 minutes, which says approximately 258,000. Yep. Okay. And now it's up to 6,600 deaths, somewhere around there.
You're almost at 9, or you're almost at 7,000 deaths. You're at
Yep.
6,907 deaths. Canada, holy crap, we jumped up a big amount. We are at 12,374 confirmed and nearly 200 deaths. My goodness.
Oh, you know what?
That's
New York jumped since yesterday. Yesterday they were at like 80,000. Now they're at 102,000 confirmed cases with about 3,000 deaths. Just New York alone.
And Turkey. Oh my goodness.
Yeah, okay, here's what I read the other day. It was 72,000. That research that they were doing in China for people over 80 and have issues with heart and lung issues are most vulnerable for that. They did that from 72,000 cases, and it was 14.8. So yeah, I had the 8 and 4 backwards there. 14.8% of them would die from that. So they're at higher risk. Which you may think that number's kind of low, but out of 72,000 cases, just 10% of that alone is 7,000. So that's a lot of people. This is going on. Let's see, now I looked at this yesterday for Nebraska. Since I'm here in Nebraska, I wanted to know. Okay, and it's at 200. Yeah, we're at 255 with only 6 deaths right now, which is pretty low. But our senator here is not doing much either. His rule is stay away from people 6 feet apart. That's it.
Yeah, amazing, right?
Yeah.
Amazing what they come up with.
6 feet apart. They have stickers and stuff at Walmart that go, "Hey, or stand here when you're waiting. Stand here when you're waiting." It's It's ridiculous. I went there as precaution. I put a mask on and everything. I was like, I'm not going out there because I have heart issues as it is. I mean, I don't. If I had it, I really don't want to be one of those percentage.
No, I completely understand. I'm just still mind blown how Event 201 simulates this outbreak, and this happened in October 2019, and then by December 2019, this comes to real life. Like, this is no more, or it's not just a simulated outbreak anymore. This is a full-scale outbreak that quickly turned to a pandemic. Yeah, and like, don't get me wrong, I'm not one for all the fear mongering. I don't want people
I'm not either.
That this is what the government did. It's hard to believe that they didn't. Because if you look at the past, if you look at the things that we have done before, it's not that far of a stretch.
You did play that Siri thing, didn't you? That's just crazy.
Yeah.
That Siri would even say that. Like, who programmed that to say that? And actually, Siri's supposed to look up stuff, and then out of the data that it's looked up, make an assumption or an answer to it. Yeah. Siri. Is it Alexa or Siri? It doesn't matter. The same thing.
Yeah. No, apparently, like, things have been taken down about it since that went viral earlier today. But yeah.
Gee.
No, it's crazy to think about, but no, it's one thing I learned is coincidences can happen, but they are so rare and few between that for this to just be a coincidence is just so unlikely.
I just want to tell people to stay healthy. Do distance yourself.
Stay healthy. Stay apart. Get away. Just get away.
Well, come on, dude. This is a digital world.
Social distancing.
And back there is all the nastiness back there.
Hey, you don't know if you can get coronavirus.
I'm not even coughing. Oh, wait. Oh, wait.
Oh, God.
Hey.
Take cover. Oh, crap. Now I gotta get back
up. You can't climb. Let's say Apex.
Same Apex or Conan. No, it ain't. No, it ain't.
Don't cut me up. I'm your friend here. You don't need to do that.
Here,
I mean, I'm not.
I will cleanse you with the fire.
Cleanse
But all right,
me.
folks, that's going to wrap it up for our little chat here. I mostly did this stream because I needed some kind of background footage for this, so I can put it on our YouTube. Because this is very interesting. Yeah, as if this is true, you know. But thank you so much for watching.
Believe what you will.
Yeah, you will believe what you will. Either you'll take this and take it and do your own research. Again, as I said, the
do your own research.
References
all of us are exactly right.
That I have will be available to you in the video, and any links I have for any prior other existing information will be available in the description.
But stay well and take care of each other.
Wash your hands.
That's all.
Wash your
hands. Doing is wash your hands. Wash your
practice
hands.
Social distancing. Social distancing. Practice it.
Yeah, I can still talk to you from over here. I'm good. I mean, I don't want to go ahead and. Oh crap! What's going on? Jeez. Maybe I do got that. It's just a killing. It's too much.
He's gonna kill us all. All right, folks. But until next time, I've been Necron 370, and stay frosty, my friends.
Later.
Yeah, I guess I did have the corona.
Wait, quick.
Did not take long.